I thought I was going to hear the music. We're live, I guess. Are we live right now? Hi, everyone. Thanks for joining us. My name's Carrie, and we're kicking it with Carrie and Dr. Annie Zhao. I've been teasing you guys all week about talking about what the number one treatment for fine lines, wrinkles, and texture is. The truth is, there's so many things that we have in the office here that help with all those things, right?
Yes.
What are some of the things, like, without naming the number one, we want to keep them waiting.
Yes.
What are some of the things that you can do for fine lines, wrinkles, and texture here in our office?
So you can start with skincare. We have a huge selection of really effective skincare. Then you can move on to procedures like chemical peels, Botox, filler. There are lasers like the non-ablative fractional laser, the picotoning laser. There are so many different options that are really popular.
So for that reason, it gets confusing, right? Like, you guys come in and the provider's kind of explaining all these different types of treatments and procedures. We've got literally a wall full of brochures or different things. And I know how hard it can be to kind of like discern which thing is the best. And they're honestly all good, but the reason some of those aren't the number one is because you have to do several treatments to get the results. And like with, let's say, the skincare, for example, you can get some improvement. You can, help, like maybe with brightening, and the wrinkles can, be decreased, but you're not going to see dramatic improvement from skincare, right?
Right. On average, you're going to see subtle improvements after about 3 months. And so it's not, like a night and day difference.
Right. And so then those other things you were talking about, like non-ablative resurfacing, or picotoning, you called it. What sort of results would you see with those things?
So you see, definite results, but you do need multiple treatments. Non-ablative means that it's just delivering heat into the skin, and then that's stimulating some collagen production. So we typically recommend 3 to 4 or 5 treatments depending on your goals, spaced anywhere from 4 to 6 weeks apart. So again, that's like 3, 4, 5 months before you get to your goal improvement.
And probably some people are like, well, why would I want to do that many treatments? It's nice because, for example, PicoSure, which is an excellent treatment we have here in the office, very little to no downtime, right? And it's quick, it's painless. To me, it's painless. Like, I don't have any issue tolerating that. Some people, do.
Some people don't even need numbing.
I don't need numbing when I do it, but very little downtime, right? And
like 1 day of redness.
Good results, so it doesn't interrupt your life, right?
Yeah.
The number one treatment that we have for fine lines, wrinkles, and texture, what would you say that is, Dr. Zhao?
I would say it's the CO2 laser, which stands for carbon dioxide laser. And this is probably one of the most powerful lasers out there. So it can give you results that are really unparalleled to a lot of the other devices and products and procedures that we have.
It's like all in one treatment.
Yeah, a lot of times you can get away with just doing one treatment and you really have really nice improvement in fine lines, wrinkles, and texture.
I think maybe we have some before and after pictures that we can show you. So why doesn't everybody do that one? Like, why do we do these other treatments?
Yeah, so to be able to produce really great results with just one treatment, there's definitely going to be downtime, more so than with the other procedures. So you're looking at like 7 to 10 days where your skin is going to be, swollen for the first few days, and then you develop tiny little scabs or crusting, and then slowly after about a week, it kind of looks, your skin feels sort of rough like sandpaper, and then after about 2 weeks, your skin looks glowing and beautiful. But you do need to have about a week to 10 days where you're not making any plans, no important meetings, no vacations or birthday parties, that type of thing. It takes
a little bit of time, but it's very well worth it. So I'm just going to review. Dr. Zhao and probably all the dermatologists here in our office and providers say that CO2, and our laser in particular is kind of special, but CO2 is probably the most effective treatment for fine lines, wrinkles, and texture, okay? What's maybe a little different about our CO2 laser, than some of the other ones that might be around?
So essentially, like all of us here, we we'll tailor the treatment to your goals and to the specific things that you want to improve. So like, let's say you just want to improve the fine lines and like little crinkles around the eyes, so that our laser can be adjusted so that we are treating the eyelid skin appropriately, because eyelid skin is much more sensitive and thinner than the skin on the rest of the face. So this laser is very customizable to whatever it is that you're wanting to treat. And then let's say you really want to get rid of deep wrinkles with just one treatment. You don't have time for a second treatment down the road. We can really increase the settings and make our laser target that deep dermis, which is that deeper layer of skin where some of that, damaged collagen is causing those wrinkles. So it's very versatile, and I think all of us here love doing it because the results are so nice.
Yeah, they're impressive. I've worked here for a long time, and I remember being kind of afraid of CO2, kind of like, whoa, that's so major. But the results are really impressive. I don't want to say, I almost use the word astounding. I don't want to oversell it, but you can see a dramatic improvement, reduction in some of those fine lines and wrinkles. Now, I see these products over here, and this in the email that I sent out and some of the advertisements about having you come watch the event was to get a treatment protocol that goes with the treatment. So this is Dr. Zhao's treatment protocol for CO2. Some of the providers change it just a little bit, but let's talk about why you pre-treat. So this is a pre-treatment, right?
For sure, yeah. So I think pre-treatment is really important. You can think of it as sort of priming the skin, getting the skin ready to receive a laser treatment. An analogy is like you want to weed your garden before you plant your new crops so that they grow better. So one product that's really special to me, my patients really love it, and they're actually getting better results from using it. It's the Elastin Regenerating Skin Nectar. It's a peptide serum that helps to speed up the removal of old damaged collagen and elastin. So as we spend time in the sun, we get older, our skin collagen sort of degrades, and so this helps to remove that degraded damaged collagen. So you start this 2 weeks before, twice a day, before the laser, and then afterwards you use it twice a day for 1 to 2 weeks after your treatment, and it actually can speed up your healing process. So instead of that 7 days where you're a little uncomfortable, usually around day 4 people are feeling better, they can put sunscreen on, they can go to the grocery store and feel okay.
Which is huge, huge to kind of get those days back and not have to be, under wraps.
Yeah, so it gives you better results, and it also speeds up your healing, so it's a win-win.
Okay, so that's good. What about the Alpha Ret?
So Alpha Ret is my favorite topical retinoid. So retinoids have been super well studied for many, many decades, that they basically can increase collagen. So these alone will help with fine lines, wrinkles, and skin texture. But like we said earlier, it takes time to see those results. But I think if you're going to invest in a laser, you should also be investing in skincare, because otherwise you're not doing what the maximum to maximize your results. So you want to maintain your results after you do your treatment. So just kind of getting in the habit of using a topical retinoid. This is like the holy grail. Like every dermatologist is on some form of a retinol until we die, basically. And this also has glycolic acid in it, which is a nice alpha hydroxy acid. It exfoliates that top layer of dead skin, so it can give your skin a really nice glow. And then using it afterwards, will just help maintain that improvement that you get.
How does it help prepare your skin for the laser, and does it also help your recovery?
So I think personally, from my own experience, that it does. I also think that because it increases skin cell turnover, you're getting rid of that dead skin on top just by using this cream, so that when you do get the laser, things are sort of already like the motor's already warm, like your engine is ready to go.
Right.
There have been controversial studies like in the literature where they haven't seen a huge difference, but I think my patients do notice a difference when they use it.
Right. Okay. And then last but not least, Dr. McNeil's Intensive Repair Night Cream, which is already kind of like, this is like a fan favorite.
Exactly. People are obsessed with this cream. It's a really hydrating moisturizer that contains peptides that also help with increasing collagen. So these products plus CO2, they just really complement each other well. And then one thing I want to mention is that CO2, lasers in general, they target they have targets in the skin. So CO2 laser is absorbed by water in your skin. So you really want to make sure your skin is well hydrated, that it's not dry in the few weeks leading up to your treatment. So this is a really, really nice treatment. So I would do it in this order. I would do this on clean skin at night, followed by this, followed by this. So kind of in this order.
So we're doing a lot of talking about the pre-treatment, and I want to just point out, so for watching, you guys are at a little bit of an advantage. We're offering this pre-treatment protocol free when you buy your face, neck, and chest for CO2, and we didn't really discuss that. Like, it's kind of a good idea to kind of do it all at once so that you don't have this demarcation, between your face and your neck and your chest. I have a little bit of that. So when you buy all three, when you get face, neck, and chest, you get all three of those products for free. And I'm just going to review pricing with you because I know I'm going to get messages, and maybe there's some messages already, Mandy, which you can fire those away. But for face, neck, and chest at our office to get CO2 with our laser with one of our providers, it's $4,500. When you do just your face, it's $3,500. You can also do just around your eyes or just around your mouth for $1,800. Okay, so that's that information. You only get this kind of pack of products when you do face, neck, and chest. Okay, so
I think it's great to do your face, neck, and chest. I'm thinking about this Instagram photo that was going around for a while where this woman had a very severe line of demarcation between her face and her neck, and she had several skin cancers on her neck but none on her face. So her face skin was smooth and wrinkle free, and then her neck was discolored, very wrinkly, and had all these scars from skin cancers. So one thing that reminded me of is that CO2 has been proven to reduce your risk of skin cancer, because we're seeing that when the skin looks healthier, it's actually because it is healthier, and your risk of developing non-melanoma skin cancer like squamous cell carcinoma and basal cell carcinoma can decrease. So that's really cool, something that everybody needs in Southern California.
That's huge. I want to repeat that because Dr. Zhao just said that getting CO2 laser, this laser that we're talking about for fine lines, wrinkles, and texture, can also help be preventative for skin cancers. And skin cancers, are curable, but usually you end up with a defect, so like a scar on your face. So the fact that you could, get this great, amazing cosmetic result and hopefully not get a skin cancer down the line is really amazing. Now, I know you in particular like to work with acne patients, and I think we have some before and after pictures of acne. I don't know if everybody that's watching is maybe an acne patient, because we really were pointing toward the fine lines, wrinkles, and texture, but maybe there's some of you out there that have some acne scarring. How does CO2 help with that?
So CO2 is great for acne scars. So I think sometimes irregular skin texture as we get older could be from old acne scars. And I've had a lot of patients say that as they got older, their acne scars got worse and worse and deeper and more noticeable. And I think part of that is the photoaging, the sun damage causes degradation of the collagen, the skin thins, and those divots or indented scars become more noticeable as time goes on. So CO2 laser, specifically the one that we have, it's fractionated laser beam, which treats a fraction of the skin, usually like 10 to 20%, in this grid-like pattern. So think of these like microscopic columns of
I think we have a video of that too.
Yes, vaporized skin that then stimulates a wound healing response from the normal skin around it, and that increases new healthy collagen to replace the old scarred tissue or the old wrinkly sun damaged skin. So it's really effective for acne scars, and I love to combine it with things like subcision, where we loosen up the attachments that are holding some of that scar tissue down. And then something called Sculptra, which is traditionally a filler, but some people, including myself, have had really nice results by applying it topically on top of lasered skin. So with CO2, you create these little channels that you can actually use to put topical, drugs. It's called laser-assisted drug delivery. So Sculptra is one thing that we can basically just rub on after your laser, and that helps further stimulate collagen. It's great for those deeper wrinkles or deeper acne scars.
That's so cool. I didn't know that. I knew that you use Sculptra sometimes for, acne scarring, but I didn't know that you just smoothed it over. I thought it was another injection after the substitch, and I was like, man, these poor people and their skin must just be kind of like...
You can totally inject it. You can subsize, inject, do the laser, and then we apply a little bit, like rub it on like a serum after your treatment, and then it sinks into the skin through those channels that we created with the laser, and so you get really nice results from both above and below the skin. So it's like 2 + 2 = 10, and when you combine all these things together.
And how nice for, I know it can really affect self-esteem when you've got acne scarring on your face, so how nice that there's a solution to kind of help improve that.
Yeah, absolutely.
Are there any questions? Let's hear them.
Could you name the products one more time?
Yeah, okay, so this is the Skin Better Science Alpha Ret Overnight Cream. It's basically prescription strength retinol with a 10% glycolic acid serum. I like to have my patients start this 1 month before the laser just to kind of get things going. This is the Elastin Regenerating Skin Nectar, the peptide serum that goes on starting 2 weeks before your laser treatment to start priming the skin, removing old damaged collagen and elastin, and then it speeds up your healing process if you use it for 1 to 2 weeks after. A lot of people will actually just keep using it because it feels so good on the skin. It has a really nice silky smooth texture. A lot of men like it too because it's not greasy, it's not heavy, and they'll just kind of use this as their skincare. And then this is the MD McNeil Dermatology Intensive Repair Peptide Cream. So this you can only get in our store or online on our website. And this is that moisturizing peptide cream that's going to increase the water content in your skin so that the laser works better.
These are all medical grade products, so I don't think that the other two products would be available, anywhere but a physician's office.
You're right, yeah.
I know, I don't have the prices memorized, but I know that the value of all three is $433. Dr. McNeil's product, I think, is $99. I think that the Elastin Skin Nectar is $199, and then I think that the other one is about $150. So, or maybe it's $130. So that's the pricing on those if you were to buy them individually. Any other questions?
How long in between treatments do you have to wait if you want to get it done again?
Some people do it yearly, right? But you don't, I don't think there's a rule, is there?
No, I think for acne scars, because, a lot of those patients want their scars gone like yesterday. They want to, do another treatment as soon as possible. So usually like the soonest I would do it would be maybe 3 months, depending on how aggressive we were the first time around. But yeah, a lot of people like to do their annual CO2 just to maintain and prevent.
Yeah.
So I like that plan.
We have a lot of patients that do that yearly because they see those results that first time and they're like, well, okay, let's just keep doing this and maybe not do all the in-between lasers. Right? Any other questions?
Could you use it for rosacea to get rid of rosacea?
CO2 is not the best treatment for rosacea. We have several other lasers in the office, like the IPL, the Cutera XLV, and then the newest one, the Verilite. So those specifically target the hemoglobin in the red blood cells. So those are kind of responsible for a lot of the inflammation and the redness and the broken capillaries that you see with rosacea.
But if you have rosacea, you can still do CO2, right?
You can still do CO2. Sometimes you have to be really careful in what products you use before and after. These are actually all really good for sensitive and rosacea prone skin. But yeah, it's good to come in for a consultation. We can make sure your rosacea is under control. Sometimes prescription medications are necessary for a little while before you can do a procedure.
And what kind of numbing is used?
So usually we do topical numbing with lidocaine, tetracaine cream. So you come into the office prior to your appointment time and we apply the cream for about an hour. And then we also can do nerve blocks where we inject lidocaine into the skin around select nerves to make it even more comfortable. And then if you tend to get anxious during procedures, we can give you some medication to help relax you as long as you have a driver. And then we also have laughing gas. So we have all kinds of
We got lots of options for that fun stuff. So
yeah, most people do really well and they're like pretty comfortable doing
yeah,
it.
It's not. It's worth it. It's worth it. Let's just put it that way. So we can take any calls tomorrow. We're closed for the night tonight. If you guys wanted to make appointments, we're happy to get you scheduled. This promotion with the 3 free products will go through if you prepay anytime before March 31st, because we might not be able to get you in before then. Prepay for your treatment before March 31st. We will give you these 3 products to pre-treat for when you get your treatment done. And again, it's called CO2. I'm here with Dr. Annie Zhao, and I really appreciate you joining us today. Was there any questions? Any other questions? Okay, and it was so nice to have some participation and questions. Thanks, you guys.
Thanks,
I
guys.
appreciate it. Thanks for joining us. You guys have a great night. Bye.
Bye.